If you take blood pressure medication every morning, I want you to pay very close attention for the next few minutes because there are two warning signs that many older adults dismiss as just getting older. One is swelling around the ankles. The other is feeling lightheaded when you stand up. They may seem minor, but in some cases they can be your body's way of telling you that your medication deserves a closer look. Not because the medicine is bad, but because understanding how it affects your body could help you stay healthier and safer. Perhaps you've been taking your blood pressure pills for years. Maybe they're sitting on your kitchen counter right now beside your coffee mug. Every morning you swallow them almost automatically, trusting that they're doing exactly what they're supposed to do. After all, your doctor prescribed them for a reason, your pharmacist refills them every month, and your blood pressure numbers may even look much better than they did before. But let me ask you something. Has anyone ever truly explained what these medications are doing inside your body every single day? Has anyone taken the time to tell you which side effects are expected, which ones deserve a conversation with your doctor, and which seemingly harmless symptoms should never be ignored? For many people, the answer is no. Prescriptions are often written during busy appointments. Pharmacists provide important instructions, but usually only have a few moments with each patient. Before you know it, you've been taking the same medication for months or even years, without really understanding how it works beyond the simple idea that it lowers your blood pressure. That lack of understanding isn't your fault, but it can leave you missing important clues your body is trying to give you. My name is Dr. James Carter, and today I want to walk you through two of the most commonly prescribed blood pressure medications in the world, Amlodipine and Losartan. If these names sound familiar, there's a good chance you, or someone you love, is already taking one or both of them. These medications have helped millions of people reduce their risk of heart attack, stroke, kidney disease, and other serious complications caused by high blood pressure. They are trusted treatments that have improved countless lives, and I want to make one thing absolutely clear from the very beginning. Nothing in today's discussion is meant to encourage you to stop taking your medication. In fact, stopping blood pressure medication suddenly without medical advice can sometimes be far more dangerous than the side effects themselves. High blood pressure often causes no symptoms until serious damage has already occurred. That is why these medications remain such an important part of treatment for many older adults. Today's goal is something entirely different. I want you to become an informed partner in your own healthcare. When you understand why you're taking a medication, how it works, what changes to watch for, and when it's appropriate to speak with your doctor, you become much more confident in managing your health. You're no longer simply following instructions. You understand the reasons behind them. Over the next few minutes, we're going to discuss how these two medications work in completely different ways, why doctors frequently prescribe them together, the side effects that are often overlooked, the blood tests that become especially important as we get older, and the everyday habits that can help you reduce your risk of complications while continuing to receive the benefits these medications provide. There's one particular risk that many seniors never hear about until after they've experienced it themselves, and understanding that single issue could make a meaningful difference in preventing one of the most common causes of injury later in life. But before we talk about side effects, there's something even more important to understand first. Why are these two medications so often prescribed together in the first place? Once you understand that answer, everything else we're discussed today will make much more sense. One of the biggest misconceptions people have about blood pressure medication is believing that every pill lowers blood pressure in exactly the same way. In reality, different medications target completely different systems inside your body. That's one of the reasons your doctor may prescribe more than one medication instead of simply increasing the dose of a single drug. Amlodipine and Losartan are an excellent example of this approach. Although both medications lower blood pressure, they accomplish that goal through entirely different mechanisms. Instead of competing with each other, they often complement each other, allowing doctors to achieve better blood pressure control while reducing the likelihood of certain side effects that may occur with very high doses of a single medication. Let's begin with amlodipine. Amlodipine belongs to a group of medications known as calcium channel blockers. While that name may sound technical, the basic idea is actually quite simple. Your blood vessels contain tiny layers of smooth muscle. These muscles constantly tighten and relax to help regulate blood flow throughout your body. Amlodipine works by helping those muscles relax. As the blood vessels become wider, blood can move through them with less resistance, making it easier for your heart to pump blood throughout your body. The result is a gradual reduction in blood pressure without forcing your heart to work harder. This is one reason why amlodipine has become such a popular choice for older adults. It works steadily throughout the day, requires only one daily dose for most people, and provides reliable blood pressure control without the dramatic ups and downs that were sometimes seen with older medications. Another advantage is its long duration of action. Even if a dose is taken a little later than usual, the medication continues working for many hours, helping maintain relatively stable blood pressure levels throughout the day. Of course, consistency is still important, but this longer action offers a bit more flexibility than some shorter-acting medications. For many seniors who are already managing several prescriptions, taking one tablet once a day is far easier than remembering medications that must be taken multiple times. Now let's look at Losartan. Unlike amlodipine, Losartan doesn't work directly on the muscles surrounding your blood vessels. Instead, it targets a hormone system that naturally raises blood pressure. Your body produces a substance called angiotensin II, which signals blood vessels to tighten and encourages the kidneys to retain sodium and water. Both of these actions increase blood pressure. Losartan blocks the effects of this hormone. When angiotensin II can no longer send those signals effectively, blood vessels remain more relaxed, excess sodium is removed more efficiently, and blood pressure gradually decreases. This different mechanism is exactly why doctors often combine Losartan with amlodipine. One medication relaxes blood vessels through the muscles within their walls. The other reduces the hormonal signals that would otherwise cause those vessels to tighten again. Together, they approach the same problem from two different directions. For many patients, this combination allows blood pressure to be controlled more effectively than either medication alone. In some cases, using two moderate doses can even be better tolerated than pushing one medication to a much higher dose. Losartan also offers another important benefit that makes it especially valuable for many older adults. Beyond lowering blood pressure, it can help protect kidney function in people with certain medical conditions, particularly those living with diabetes or early kidney disease. Since kidney health becomes increasingly important with age, this additional protective effect is one reason physicians frequently choose Losartan as part of a long-term treatment plan. So when you look at these two medications together, it's easier to understand why they've become one of the most common combinations used around the world. They're not duplicates. They're partners, each performing a different job to achieve the same overall goal, reducing the strain that high blood pressure places on your heart, brain, kidneys, and blood vessels over time. But every medication that provides meaningful benefits also comes with important considerations. And while most people have heard that amlodipine may cause swollen ankles, very few understand why it happens, when it's harmless, when it deserves medical attention, and what other side effects often go completely unnoticed. Let's begin there, because the next few minutes may explain symptoms that many older adults have been living with for years, without ever realizing they could be connected to a single daily pill. Now that you understand why amlodipine is so commonly prescribed, let's talk about the part that often catches people by surprise. For many older adults, the medication itself isn't the problem. The problem is not recognizing when a new symptom might be related to the medication instead of simply blaming it on aging. One of the most common examples is swelling around the ankles and lower legs. If you've ever noticed that your shoes feel tighter in the evening than they did in the morning, or you've seen sock marks becoming deeper by the end of the day, you may have experienced this yourself. Many people immediately assume they're retaining water because of their heart, their kidneys, or simply because they're getting older. While those possibilities certainly exist, amlodipine is also a very common cause. Here's why. As amlodipine relaxes blood vessels, it changes the pressure inside the tiny blood vessels known as capillaries. In some people, this allows a small amount of fluid to move from the bloodstream into the surrounding tissues, especially around the ankles, where gravity naturally pulls fluid downward throughout the day. That's why swelling caused by amlodipine is often more noticeable in the evening and may improve overnight while you're lying down. The important point is this: not every swollen ankle means something dangerous is happening. In many cases, this side effect is mild and doesn't indicate damage to the heart or kidneys. However, that doesn't mean you should simply ignore it. If the swelling is becoming more noticeable, affecting your comfort, making shoes difficult to wear, or suddenly becoming much worse, it's worth discussing with your doctor. Sometimes lowering the dose is enough to improve the problem. Sometimes another medication is adjusted to reduce the swelling. Occasionally, a different treatment may be a better fit altogether. The key message is simple. Don't assume you just have to live with it. Now let's move to another side effect that usually appears early after starting the medication. Some people notice warmth spreading across their face or neck. Others describe it as sudden flushing, almost as though they're embarrassed or standing in a hot room. This happens because the blood vessels near the surface of the skin become more relaxed, allowing greater blood flow. Although it can feel unusual, it usually becomes less noticeable as the body adapts over the following weeks. Mild headaches can develop for a similar reason. As blood vessels change the way they expand and contract, some people experience temporary headaches during the first few days or after an increase in dosage. Fortunately, these headaches often improve without requiring any change in treatment. But the side effect that concerns me far more than headaches is dizziness. Not severe dizziness, not spinning sensations. I'm talking about those brief moments when you stand up and suddenly feel unsteady for 2 or 3 seconds. Many people laugh it off. They'll say, "I stood up too fast." Then they continue walking as though nothing happened. The problem is that these short episodes can become much more significant as we grow older. Our balance naturally becomes less reliable with age. Reaction times slow down. Muscle strength may not be what it once was. When you combine those normal age-related changes with a medication that lowers blood pressure, even a few seconds of lightheadedness can increase the risk of losing your balance. We'll talk much more about that later because it's one of the most important discussions we'll have today. Another side effect that rarely gets mentioned involves your gums. Although it's uncommon, amlodipine can sometimes cause gum tissue to become enlarged or thicker over time. People who don't receive regular dental care or who already have gum disease may notice this more than others. Good brushing, flossing, and routine dental visits often reduce the likelihood of this becoming a significant problem, but if you notice changes in your gums, don't assume it's only a dental issue. Let both your dentist and your prescribing doctor know. Some people also experience constipation after starting amlodipine. While this doesn't happen to everyone, it can become frustrating, particularly for older adults who may already struggle with slower digestion. Remaining physically active, drinking enough fluids, and eating adequate dietary fiber may help, but persistent constipation should still be discussed with your healthcare provider. Here's something else that's worth remembering. Compared with several older blood pressure medications, amlodipine generally causes fewer problems involving blood sugar, cholesterol, energy levels, or sexual function. That's one reason physicians continue prescribing it so frequently. Like every medication, however, its benefits come with responsibilities. The more familiar you are with the changes your own body experiences, the easier it becomes to recognize when something deserves medical attention, rather than being dismissed as just part of getting older. But now let's turn our attention to the second medication. Many patients assume Losartan is the simpler of the two. In reality, while it's an excellent medication for many people, there are several hidden considerations that become especially important after the age of 60. Losartan has earned an excellent reputation over the years, and for good reason. It effectively lowers blood pressure, is generally well tolerated, and offers important protection for the kidneys in many patients. For countless older adults, it has become a reliable part of long-term treatment. But one of the biggest mistakes people make is assuming that because a medication feels gentle, there's nothing important to monitor. In medicine, that's rarely true. Every medication has certain things that deserve attention, and Losartan is no exception. Let's begin with something most patients have never been warned about in detail: potassium. Potassium is an essential mineral that helps muscles contract, nerves communicate, and most importantly, allows your heart to beat with a normal rhythm. Your body works very hard to keep potassium levels within a narrow, healthy range. Losartan can sometimes cause those levels to rise. For many people, the increase is small and never becomes a problem. But older adults often have several factors working together. Kidney function may naturally decline with age. Some people have diabetes, others take additional medications that also increase potassium. When several of these factors combine, potassium levels can gradually climb higher than expected. The challenge is that high potassium doesn't always produce obvious symptoms. Many people feel completely normal. Others may notice weakness, unusual fatigue, muscle heaviness, or occasional palpitations. Sometimes there are no warning signs at all until a routine blood test discovers the problem. That's exactly why regular laboratory monitoring is so important. Your doctor isn't ordering those blood tests simply because it's routine. They're checking whether your kidneys are handling the medication appropriately and whether your potassium remains in a safe range. This becomes especially important after starting Losartan, after increasing the dose, or whenever another medication is added to your treatment plan. Another topic that often causes confusion is food. You may have heard someone say that people taking Losartan should never eat bananas or tomatoes. That's an oversimplification. Foods such as bananas, oranges, potatoes, avocados, beans, leafy vegetables, and certain salt substitutes contain higher amounts of potassium, but that doesn't automatically mean they're unhealthy or forbidden. For most people, these foods remain part of a balanced diet. The important point is that if your doctor has specifically told you your potassium level is running high, dietary adjustments may become necessary. That's why individualized medical advice always matters more than generalized rules on the internet. Now let's discuss another important issue: kidney function. Many people are surprised to learn that Losartan can both protect the kidneys and require kidney monitoring at the same time. Those two ideas are not contradictory. In fact, they're closely connected. For many patients, especially those living with diabetes or early kidney disease, Losartan helps reduce long-term damage to the kidneys. However, during certain situations, such as severe dehydration, prolonged vomiting, persistent diarrhea, or illnesses that greatly reduce fluid intake, the kidneys become more vulnerable. During those periods, continuing the medication exactly as usual may not always be the safest approach. That's why it's important to contact your healthcare provider if you become seriously ill and cannot keep fluids down or are losing large amounts of fluid. Your doctor may recommend temporarily adjusting your medications until you've recovered. Never make that decision on your own, but don't ignore those situations either. Another consideration is blood pressure itself. Just like Amlodipine, Losartan lowers blood pressure. When both medications are working together, they often provide excellent control. But occasionally, especially after beginning treatment or increasing the dose, blood pressure can fall lower than expected. Some people notice this as mild fatigue. Others experience brief dizziness. A few feel perfectly fine while sitting, but become lightheaded the moment they stand. This isn't necessarily a sign that the medication is wrong for you. It may simply mean your body needs time to adjust, or that your treatment plan should be reviewed. Either way, it's valuable information for your doctor. One additional point deserves mention. Losartan should never be used during pregnancy because it can seriously harm a developing baby. Although this warning doesn't apply to most older adults, it's an important safety consideration for younger patients who may still become pregnant. Finally, remember that even medications with excellent safety records deserve ongoing attention. Taking the tablet every day is only one part of successful treatment. Understanding how your body responds over time is equally important. Because here's what many people don't realize. The greatest risk for many seniors isn't caused by amlodipine alone. It isn't caused by Losartan alone. It's what can happen when both medications are doing exactly what they were designed to do. And your blood pressure falls just a little too much when you stand up. That single moment of dizziness is where our next discussion begins, and it may be the most important part of this entire conversation. We've talked about how amlodipine works. We've talked about Losartan. We've discussed swelling, potassium levels, kidney function, and routine blood tests. But if you asked me which issue concerns me the most in my older patients taking these medications, my answer would probably surprise you. It's not swollen ankles. It's not constipation. It's not even a slightly elevated potassium level. It's falling. More specifically, it's falling because blood pressure drops for just a few seconds when someone stands up. This condition is called orthostatic hypotension. The name sounds complicated, but the idea is actually very simple. When you're sitting or lying down, gravity isn't pulling as much blood toward your legs. The moment you stand, gravity suddenly shifts blood downward. Your body normally reacts within seconds by tightening blood vessels slightly and increasing blood flow back to the brain. Most of the time, you never notice this process because it happens automatically. However, blood pressure medications are designed to relax blood vessels and reduce blood pressure. Sometimes, especially when two medications are working together, your body doesn't adjust quite as quickly after you stand. For a few brief moments, less blood reaches your brain. That's when you may notice dizziness, blurred vision, or the feeling that you need to grab onto something. Many people dismiss these episodes because they disappear so quickly. They think, I just stood up too fast. Then they continue with their day. Unfortunately, that small moment of dizziness can sometimes become the beginning of a very serious accident. Imagine waking up in the morning. You swing your legs over the side of the bed. You're thinking about making breakfast or feeding the dog. You stand up quickly. For 2 or 3 seconds, your vision darkens. Your balance disappears. Your foot catches the corner of a rug. Suddenly, you're on the floor. That scenario happens far more often than most people realize. Falls are one of the leading causes of hospitalization among older adults, and the consequences often extend far beyond the initial injury. A fractured hip can require surgery. Weeks of rehabilitation may follow. Muscle strength declines rapidly during long periods of inactivity. Confidence disappears. Some people become afraid to walk without assistance. Others never fully regain the level of independence they once enjoyed. And it all began with what seemed like a harmless moment of dizziness. This is why I encourage my patients never to ignore repeated episodes of feeling lightheaded after standing. Instead, pay attention to the pattern. Does it happen only occasionally? Does it happen every morning? Does it happen after taking your medication? Does it become worse after exercising, taking a hot shower, or spending time outside on a warm day? These details help your doctor determine whether your medications should be adjusted or whether another medical condition may be contributing. The good news is that preventing these episodes often starts with very simple habits. The first is learning to slow down. When you wake up in the morning, resist the urge to jump out of bed immediately. Instead, sit on the edge of the bed for 20 or 30 seconds. Move your feet gently. Take a few slow breaths. Allow your circulation to adjust before standing. Once you stand, don't begin walking immediately. Pause for another few seconds. Make sure you feel steady before taking your first steps. If you know you've experienced dizziness before, place one hand on a sturdy piece of furniture while you stand. That extra point of support may prevent a serious fall. Hydration is another factor that many people underestimate. Your body depends on adequate fluid to maintain healthy blood pressure. Even mild dehydration can make dizziness significantly worse. Older adults often don't feel thirsty until they're already becoming dehydrated, so relying on thirst alone isn't always the best strategy. Unless your doctor has placed you on a fluid restriction because of heart failure or another medical condition, maintaining good hydration throughout the day is one of the simplest ways to support healthy circulation. Heat can also play a surprisingly important role. A long hot shower, soaking in a hot bath, or spending time outdoors during very warm weather causes blood vessels to relax even further. When that effect combines with blood pressure medication, the drop in blood pressure upon standing may become more noticeable. If you enjoy hot showers, consider sitting for a moment before stepping out. Give your body time to adjust before walking across a slippery bathroom floor. Alcohol deserves attention as well. Even moderate amounts can temporarily lower blood pressure and affect balance. When alcohol is combined with medications that already reduce blood pressure, dizziness may become much more likely. That doesn't necessarily mean everyone must avoid alcohol completely, but moderation and extra caution afterward are certainly wise. Most importantly, don't keep these symptoms to yourself. If you've experienced repeated dizziness, near falls, or actual falls, tell your doctor. Those conversations are incredibly valuable. Sometimes the solution is adjusting the dose. Sometimes it's changing when the medication is taken. Occasionally, another medication is a better choice altogether. Small adjustments made early may prevent a life-changing injury later. Now that we've discussed the biggest practical risk associated with these medications, let's talk about what you can do every single day to make your treatment safer, more effective, and easier to manage over the long term. Taking your medication every day is only one part of managing high blood pressure successfully. The habits that surround your medication are just as important. In fact, two people can take exactly the same prescription and have very different results simply because of the routines they follow each day. Let's begin with one of the most valuable tools you can own, a home blood pressure monitor. Many people only learn their blood pressure during doctor's appointments, but that provides only a small snapshot of what's happening. Blood pressure naturally changes throughout the day. Stress, poor sleep, dehydration, exercise, illness, caffeine, and even anxiety about being in a medical office can all influence the reading. Checking your blood pressure at home gives both you and your doctor a much clearer picture. Choose a consistent time each day whenever possible. Sit quietly for about 5 minutes before taking the measurement. Keep both feet flat on the floor. Rest your arm comfortably at heart level. Avoid talking while the monitor is measuring. These small details improve the accuracy of the reading more than many people realize. Don't become overly focused on a single number. Instead, look for patterns over several days or weeks. A written log or a simple digital record can be incredibly helpful during medical appointments because it allows your doctor to see trends rather than isolated readings. It's also useful to know your personal blood pressure goal. Many older adults hear that lower is always better, but that's not necessarily true. Blood pressure targets should be individualized based on age, medical history, kidney function, diabetes, cardiovascular disease, and other factors. Your doctor can tell you what range is appropriate for you. If your readings consistently stay well above that target or consistently fall below it, that information deserves medical attention. Equally important is recognizing the signs that your blood pressure may be dropping too low. Persistent dizziness, unusual fatigue, blurred vision, feeling faint, difficulty concentrating, repeated episodes of unsteadiness. These symptoms don't automatically mean your medication is causing the problem, but they should never be ignored. Routine blood tests are another essential part of safe treatment. If you're taking Losartan, your doctor will often monitor kidney function and potassium levels from time to time. Those laboratory results help confirm that your treatment continues to be both safe and effective. Skipping follow-up appointments simply because you feel well may cause important changes to go unnoticed. Consistency with your medication also matters. Try to take your tablets at approximately the same time each day. A regular routine helps maintain stable blood pressure and reduces the chance of accidentally missing doses. Many people find it helpful to connect their medication with an existing habit, such as brushing their teeth or eating breakfast. What if you forget a dose? That happens to nearly everyone at some point. In most situations, take the missed dose as soon as you remember unless it's already close to the time for your next scheduled dose. If that's the case, simply continue with your normal schedule. Don't double the dose to make up for the missed tablet unless your prescribing physician has specifically instructed you to do so. Medication interactions deserve attention as well. Prescription medicines aren't the only products that matter. Over-the-counter pain relievers, cold medications, herbal supplements, vitamins, and even some natural health products can sometimes affect blood pressure or interact with your prescriptions. Before starting anything new, let your pharmacist or healthcare provider review it. That brief conversation may prevent unexpected complications. There are also certain situations in life that require extra awareness. If you're preparing for surgery or a medical procedure, always tell your surgical team exactly which medications you're taking. Some medications should be taken on the morning of surgery, while others may require temporary adjustments. Never guess. Always follow the instructions provided by your healthcare team. Illness can also change how your body responds to blood pressure medication. If you've been vomiting repeatedly, experiencing severe diarrhea, or unable to drink enough fluids for an extended period, dehydration may significantly affect your blood pressure and kidney function. Instead of waiting until your next appointment, contact your healthcare provider for guidance. Another encouraging point is exercise. Regular physical activity remains one of the most powerful ways to improve cardiovascular health. Walking, swimming, cycling, light resistance training, or other physician-approved activities can support healthy blood pressure over time. However, if you're beginning a new exercise program after years of inactivity, monitor how you feel. As your overall health improves, your blood pressure may change, and your treatment plan may eventually need adjustment. Finally, remember that medications should never replace communication. If you notice persistent ankle swelling, repeated dizziness, unusual fatigue, heart palpitations, major changes in urination, or anything else that concerns you, don't wait months hoping it will disappear on its own. Bring those observations to your doctor. The more information you share, the easier it becomes to tailor your treatment specifically to your needs. At the end of the day, the goal isn't simply to lower blood pressure. The goal is to help you stay healthy enough to continue enjoying your family, your independence, and the activities that matter most. And that's exactly what we'll focus on as we bring everything together in the final part of our discussion. As we come to the end of today's discussion, I'd like to leave you with one message that I believe matters more than anything else we've talked about. Blood pressure medications are not your enemy. They're not something to fear simply because they may have side effects. They're tools. When they're prescribed appropriately, monitored carefully, and combined with healthy daily habits, they become some of the most effective tools we have for protecting the heart, brain, kidneys, and blood vessels from the long-term damage caused by uncontrolled high blood pressure. The purpose of today's conversation was never to convince you to question every pill you take. Instead, it was to help you ask better questions, to notice changes in your body, to recognize symptoms that deserve attention, and to become a more active participant in your own healthcare. Far too many people believe their responsibility ends once they swallow their medication each morning. In reality, that's only the beginning. Your observations matter. The swelling you notice at the end of the day matters. The dizziness you experience after getting out of bed matters. Your home blood pressure readings matter. Your blood test results matter. And perhaps most importantly, the conversations you have with your healthcare team matter. Medicine works best when it's a partnership. Your doctor brings medical knowledge and clinical experience. You bring something equally valuable. You know your own body. You know when something feels different. You know when a symptom has gradually become more noticeable. Sharing those observations helps your doctor make decisions that are based not only on numbers, but also on how you're actually feeling in everyday life. Remember that medications often need occasional adjustments. The dose that worked perfectly 5 years ago may not be the ideal dose today. Your health changes over time. Your kidneys change. Your activity level changes. Your weight may change. Other medications may be added. That's why regular follow-up appointments remain so important, even when you feel perfectly well. If you ever develop persistent ankle swelling, repeated episodes of dizziness, fainting, unusual heart palpitations, major changes in urination, severe weakness, or any other symptom that concerns you, don't simply search for answers online and hope for the best. Reach out to your healthcare provider. Most concerns can be evaluated quickly, and if an adjustment is needed, it's almost always much safer to make that decision together than to stop or change your medication on your own. There are also situations where you should seek immediate medical attention rather than waiting for your next appointment. If you experience chest pain, severe shortness of breath, signs of a stroke such as sudden weakness, facial drooping, difficulty speaking, sudden confusion, fainting, or extremely abnormal blood pressure accompanied by severe symptoms, seek emergency medical care without delay. Those situations require prompt evaluation. For everything else we've discussed today, remember this simple principle. Stay curious, stay observant, stay engaged. The more you understand about your medications, the more confidently you can work together with the professionals who care for you. That partnership is one of the greatest advantages you can have as you grow older. Before we finish, I'd love to hear from you. How long have you been taking blood pressure medication, and what is one thing you learned today that no one had ever explained to you before? Your experience may help someone else who's quietly dealing with the very same questions. If you found today's discussion helpful, consider sharing it with a family member or a friend who also takes medication for high blood pressure. Sometimes a simple conversation can give someone the confidence to ask an important question at their next medical appointment. Finally, I'd like to leave you with one reassuring thought. Taking blood pressure medication doesn't mean you've failed. It means you're taking steps to protect your future. Every healthy blood pressure reading represents another opportunity to reduce your risk of stroke, heart attack, kidney disease, and other serious complications. Combined with regular physical activity, nutritious meals, quality sleep, good hydration, and ongoing communication with your healthcare team, these medications can play an important role in helping you remain active, independent, and able to enjoy the people and moments that matter most. Everything we've discussed today is intended for educational purposes only and should never replace personalized medical advice from your own physician or pharmacist. Every individual has a unique medical history, and treatment decisions should always be made together with the healthcare professional who knows your situation best. Never stop, start, or change your medication without first discussing it with your doctor. Thank you for spending this time with me. Thank you for choosing to learn more about your health instead of simply accepting uncertainty. I'm Dr. James Carter, and I look forward to seeing you again in our next conversation. Until then, take care of yourself, stay informed, and continue making small choices each day that support a healthier future.